Hi guys, good evening. How many of you are in here today? The 8 members have joined. What about the rest? So yesterday we have stopped at we have covered Medigap coverage as well. Can someone at least give me a summary like what exactly we have covered yesterday? Even though it is like 2 to 3 topics even. Can someone? Priya?
Ma'am, in the last session, we have discussed about
Yeah. Yes,
Medigap
ma'am.
coverage. Medigap coverage means services not provided by the Medicare.
Come again, ma. Your voice is actually breaking.
Medigap coverage is service that not provided by the Medicare. It covers the services that are not under cover by Medicare. Ma'am, am I audible?
Make it more
Okay,
clear,
ma'am.
na? It's like confusing for me itself. Yeah.
Okay, ma'am.
Make it clear. Yeah.
In the last discussed about Medicare and then about Medigap coverage.
Priya, before
Now,
you explaining, sorry to interrupt. So before you explain, could you please check your network now? Yeah. Yes.
ma'am, am I audible now?
Okay, but not that clear. Uh, Try to speak. Yeah.
Okay, ma'am. Railroad Medicare. Another one is
I mean, you are explaining about the Medicare, Medigap coverage, ma. Yeah. Can you
okay,
complete
ma'am.
it?
Again, I will come back.
Yeah. Okay.
Medigap coverage is a service that provide medical services that are not provided by the Medicover. And then Railroad Medicare. It is a Medicare plan for railroad employees. It is operated by railroad services.
Mm-hmm.
And lastly discussed about Medicaid.
I
It is a
mean,
federal.
this railroad, like, to whom do we provide this policy? To whom do we give that policy? Who are
It is a
guys?
Medicare plan
Don't.
for railroad retirees, ma'am. It is administered by railroad. And then
Mm,
about lastly, we discussed about Medicaid. It is a federal plan operated by state government. It
mm.
is a Medicare plan for people with less income. And then lastly, discussed about the eligibility criteria for Medicaid service. The
Who are
eligibility
eligible for
criteria,
that? Who are eligible?
yeah,
Ma'am, you're
low income families, daily
Just a
wage
minute.
working
Just a minute.
people.
Just a minute, Priya. Sorry to interrupt. Someone is saying something. Thank you, ma'am. Yes, you can cover Priya. Apart from Priya, can I expect any other person to cover like other topics, like what exactly I have covered till now? I mean, since till yesterday.
Yes, ma'am. Okay, ma'am. Eligibility criteria for Medicaid plan is low income families and daily wage working people, disabled person, infants born to pregnant women, and the families who depend on a single income of the person. That's
It's
it,
like
ma'am.
ma. So for this, that is a Medicaid eligibility. It
Yes,
is
ma'am.
for
I'm
Medicaid
saying about the
eligibility.
Medicaid.
So that like the example, I mean, as you have mentioned, like is single income person. I mean, the person who is only one who is earning for that family. That is
Yes.
like an example which I gave you for this low income families. That comes under the low income families. Okay.
Okay, ma'am.
Yes, go ahead. That is
That's it.
for
Completed.
Medicaid eligibility. And what about this? We have even discussed about Medicare as a secondary payer. It's not only like we only give this Medicare facility for the 65 people, I mean, to the senior citizen who is like at the age around 65, but also we provide the services for other persons as well. How this policy works for the as a secondary payer, to whom we have even discussed that as well. What exactly, who else comes under the into this?
Working age people,
Working aged people. Okay.
disabled people, persons suffering with chronic disorders.
End stage of renal disease. Yeah. What is meant by renal disease? Can anyone apart from Priya?
Chronic kidney disorder. I'm Prasanna, ma'am.
Thank you, ma'am. Yesterday, were you there? Can you cover the other topics which I have explained?
Yes, ma'am.
Yes. Continue. Thank you, Priya. Yes, Prasanna. Please continue.
Today we discussed about Medicare, Railroad Medicare,
Mm-hmm.
Medigap coverage,
Mm-hmm.
Medicare as the secondary payer,
Mm-hmm.
and lastly about Medicaid.
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 Medicaid. What exactly is Medicaid? Could you please explain about it?
Medicare or Medicaid, ma'am?
Medicaid.
Medicaid. Okay. Medicaid is a federal plan.
Mm-hmm.
It is administered by the state
Mm-hmm.
government.
Mm-hmm.
It is applicable for the middle class people who have less income.
Mm.
And the eligibilities include
Mm.
daily wage people,
Mm.
infants of a pregnant woman
Yeah, who are eligible to
who are
Medicaid.
eligible for Medicaid,
Mm.
and the families with very low income, like having only
Yeah.
one person's income.
Mm. Who
And
is
for the people,
dependent?
yes, ma'am. And for the
Whoever
people,
can.
who are above the age of 65 years and who cannot meet their expenses.
Mm.
That's it about Medicaid, ma'am.
So, what about this Medicaid, Medicare as a secondary?
Medicaid as a secondary payer is applicable for the working aged people who
Mm.
have complete end stage renal disease. Complete means permanent end stage renal disease.
Mm-hmm.
And it is applicable for the disabled people as well.
So, shall we just jump to the next topic? So, the next one is a private plan we'll discuss about. In that, we'll cover now Blue Cross Blue Shield. There is a plan, right? Hope you guys remember that. Did you? Do you? BCBS. So, Blue Cross Blue Shield. So, it is completely a not for profit plan. So, it that is an entity with that offers health insurance through more than, so it offers more than 70 different for more than 70 different organization which is locating in every state. Okay, it is a not for profit entity that comes under, so it's like completely a serving thing which which serves not for profit.
Blue Cross Blue Shield, ma'am.
Priya, is that you?
Yes, ma'am.
Yeah. So Blue Cross Blue Shield, which is a non-profit kind of entity which offers health insurance through more than how many organization, how many places? Like
70 different
in
organizations.
every state. So 70 different organizations. Okay. So it is one of the best private health insurance we gotta say. So it was one of the first private health insurance organizations. So it has like, as it was one of the first health organization, that to private. So it offers the more than 70 different organizations. So because of that, it has a large enrollee population, which is like many people enroll into this plan, which is a private plan, that is BCBS. As it works for like a non-profit. So, and that too, which has started, which was the first one that is being shared with, or that is being offered to many organization in every state. So hence the many enrollers were enrolled to BCBS. Did I hope you understand? No, I can explain you clearly again, once again. Anyone say yes or no? Why don't you speak out, guys? Priya, did you understand?
Yes,
Priya,
ma'am.
Prasanna?
Yes, ma'am.
Yes, ma'am.
Understood.
Yeah. Do you want me to explain it once again?
No need, ma'am.
Yeah. So anyone explain about this plan, this private plan, which is like BCBS? What exactly is that? And
BCBS is the first private health insurance
one of the
organization.
first private health
Okay, okay.
insurance. It's
Sorry, ma'am.
not
One
like
of
that is the only one. It is one of the first private health insurance organizations, and
okay,
that too, it is a not for profit thing. It
okay, ma'am.
not, it is like not completely into look into the profit. Understood? It's not like completely into the business thing which only looks mostly for profits. Yeah. Yes, continue.
This offers for more than 70 different organizations in
Hmm.
several different states.
Mm.
And
Wherever it is located in every
yes,
state.
ma'am. Yes, ma'am. And it
Mm.
has a large enrollee population,
Because why there were many enrollers here?
as it is one of the first private health organization, and it has offers in more than 70 different organizations.
Not only that, it is a
And it
not
is
for
in
profit.
it is not for profit, and it is almost in every state.
Mm. Yes, guys. So the next one is like workers' compensation. So what exactly is meant by the workers so guys, so workers compensation is nothing but it is like a requirement of this federal government for the employers of the patients, whoever is taking care of the patients or who is working for these patients, like those who are being injured, of the patients who are injured or who become sick while they are doing their job. So that is called as like workers compensation. Understood?
Ma'am, can you repeat again?
Yeah, so workers' compensation is the requirement of the federal government for whom? For the employers of the patients. For the employers of the patients who are like injured, who become sick when they are doing their job, when they are working on their job. So that is the for the person who is being sick or being injured. So that is called as like workers' compensations. We pay for them. Understood? Are you guys noting points? Are you noting down those points? Is that the reason why you guys are not even saying something or speaking out? Yes. Shall we jump to the next one, which is like commercial insurance? So, what exactly is a commercial insurance? So, commercial insurance is a company, so that is like which is like a carrier thing. So, which it what it does, it offers more than just uh, health insurance. Health insurance కాకుండా ఇంకా చాలా ఆఫర్ చేస్తుంది, which is like an auto insurance, life insurance, home insurance, like what exactly we have like normal గా మనకి ఇప్పుడు ఇన్సూరెన్స్ ప్లాన్స్ ఉన్నాయి కదా. సో అలాగా, సో ఇట్ ఆఫర్స్ నాట్ ఓన్లీ హెల్త్ ఇన్సూరెన్స్, ఇంకా చాలా ఇన్సూరెన్స్ ప్లాన్స్ అనేవి సో ఇట్ విల్ ఆఫర్. So what this insurance, it is financed by whom? Enrollee premiums. So premiums ante enti? So the premium is nothing but like what exactly? So the pe- the people whoever is like enrolled for any insurance plan, so normal ga ఆ ఇన్సూరెన్స్ ని మాత్రమే పే చేయకుండా సో మోర్ దాన్ ఇట్ దే కవర్ like other things as well in this, which is like deductibles, like inka ememi um, other costs which are included in apart from the payment which they are paying for, not only for insurance but as well as they cover the other costs of the healthcare, including the deductibles, other payments, any other insurance which is a co-insurance. So that is called as like a premiums. So who is like paying is an enrollee. Enrollee is a person who is enrolled to the premiums or insurance plans. Okay, did you understood? Who enrolled into who enrolled for these plans is called as an enroll. Who enrolled for the premium plans is enrollee premiums. Understood the meaning?
Yes,
Yes.
ma'am.
Yeah. So these are for these commercial insurance. These plans are like or these companies are like they look out for profits as they are private, and these people, these companies look out for the mostly they look out for profit. They look into the profits mostly, not like they are serving, but they are doing like a business. Okay, so there, which is like in short we can say like these people are mainly their main goal, their end goal is to make more money from this. Why you guys are leaving and again joining like that? Shall we jump to the next topic, which is like commercial insurance plan? ఇప్పుడు వరకు కమర్షియల్ ఆర్గనైజేషన్, కమర్షియల్ కంపెనీ ఏంటి, సో వాట్ డూ దే డూ అనేది మనం తెలుసుకున్నాం. సో వాట్ ఎగ్జాక్ట్లీ దిస్ ఇన్సూరెన్స్ ప్లాన్ is like, what do they, how much do they cover? So what exactly this commercial insurance plan here in this medical thing? This doesn't come under like either state government gani, so central government gani, ఏ గవర్నమెంట్ ఇందులో ఇన్వాల్వ్ అనేది అవ్వదమ్మా. This is completely a private thing. Okay, this is one of the health insurance plan. It is not maintained by any government. Okay, so that is the reason why it is called as like commercial insurance plan. As no government or no federal government or the state government is being taking care of this thing or involved in this thing, so that is the reason why we call this as a commercial plan, which is like they completely make money out of the individuals. Shall we jump to the next topic? I mean, shall we discuss this commercial insurance plan? What exactly this covers is like. Okay, then I'll just I'll just explain this topic and I'll just. So this commercial insurance plan, as I said mentioned earlier, like this is there will be no involvement of any state or any government, federal government, anything. So because it's like completely private and it will be completely focusing on their profits gaining from the individuals. Okay, so that is the reason why it is called as a commercial insurance plan. So they mostly focus on like making money. Understand?
Yes, ma'am.
So we can even like call this commercial insurance plan as like a business. We call it as like business insurance. Commercial, which is business. So we can call it as like business insurance plan. So this insurance company, so what do? They will pay maximum of the claim amount. So while where when it comes to the patient, so they make if they if they pay 30, so these people will pay like 7. So that is the thing that they do. So what do these companies cover? How much do they cover? So maximum of the amount these people will cover. Who the commercial in this insurance plan, so they cover maximum of the amount, and whereas like the other individual, so what do? That patient covers 30%. If this covers if they cover 70%, this person or the individual or the patient that covers 30%. Understood? That's how this works like in this commercial insurance plan. So here we have different types in this commercial plan, like individual plan we have, group plan also we have. So if only one person is purchasing this commercial plan, so that is the individual plan. If the if more than one person collectively they are purchasing this plan, that is a group plan or a collective plan, we can say. Understood?
Yes, ma'am.
So how this group plan can be taken? So if there is like if there is a company, okay, there is a company in which many people work there. So for those people, this so and so that employer who gives the employment to the employees, so that person purchases this plan, which is a group plan. Understood? That is the reason why we call it as a group plan. Group plan can be taken by the employer of that company. So pays who pays money, or employ who gives employment to the others. Understood? సో వాళ్ళకి ఇన్సూరెన్స్ పర్చేస్ చేయడానికి వీళ్ళు తీసుకుంటారు, ఎవరు? ఎంప్లాయర్ ఆఫ్ దట్ కంపెనీ. సో కంపెనీ వాళ్ళు తీసుకుంటారు కొంతమందికి, ఆల్ ఎంప్లాయీస్ అందరికి ఇవ్వడానికి. సో that is the reason why it is called as a group plan on behalf of all these people. So collectively together taking a plan is called as a group plan. Understood? Individual purchase cheste, that is an individual plan. Understood? By only one person directly reaching out to that and taking that plan is considered as an individual plan. Understood? Yes or no? Maybe.
Yes, ma'am.
Others, I need response from everyone. If not, as I said just before that I'll just leave like that. So next topic, which is like managed care. What exactly is managed care? So that is one of the plan. Yes, ma.
Ma'am, I have a small doubt.
You have a small doubt. Yes, thank you. Yes, even Sailu. You left and you have entered again. Yes. Who is this? Prasanna. Is
Ma'am,
Prasanna
they
asking me
say
the
that
question?
insurance companies provide family plans.
Uh,
How does that work?
Come again, ma.
Insurance companies provide family plans, no ma'am.
Collective plan. అది family plan.
Group plan, you told that a group plan is taken by the employer and given to the
Yeah.
employee.
Yes, exactly.
Then how the
Exactly.
family plan is taken and for whom it will be applicable? Total family or only for 4 members?
For the family or for the 4 members, that doesn't come under this.
Okay,
ఇప్పుడు
ma'am.
ఓకే. సో కలెక్టివ్ ప్లాన్ అంటే సో గ్రూప్ ప్లాన్ అంటున్నారు. సో దట్ కెన్ బి టేక్, ఐ మీన్ యాజ్ ఐ మెన్షన్డ్ ఎర్లియర్, like the employer can be given, I mean collectively taking care. Yes, Prasanna, sorry guys, explain, sorry, what was your doubt? Could you please repeat it again?
Insurance companies provide family plans, no ma'am.
Yes, they do.
Then how does that work? Like, is it applicable for the whole family or only for the 4 members of the family?
whole family whole family.
I mean, if a family has 10 members, for example,
Okay,
then is it applicable for all the 10 members or not?
done with the work. I submitted EOD. I submitted my EOD to you. Wait. Yes, sorry guys. Yep. Prasanna, yes, you were
Ma'am.
asking about this group insurance plan, right? I mean, like the whole family thing, right?
Yes, ma'am.
Yeah, yeah. So what happens is like మనం ఎంప్లాయీకి మనం ఇస్తున్నప్పుడు, so employer is giving to an employee the commercial this plan. So what happens, ఆ ఎంప్లాయీ దాంట్లో, సో దట్ కెన్ బి గివెన్ లైక్ అంటే, సో ఇలా పెట్టుకుంటారు కదా, ఏమంటారు, సో ఇన్ దాట్ their spouse, their children, that those people can be added, వాళ్ళ ఫ్యామిలీ మాత్రం యాడ్ అవ్వచ్చు, నాట్ లైక్ వాళ్ళ రిలేటివ్స్, వాళ్ళ లైక్ అక్క చెల్లి అలా ఉండదు. అండర్స్టూడ్?
Okay, ma'am.
యా. ఎస్. ఎనీ క్వశ్చన్స్?
Ma'am, what if we take on ourselves family plan?
Ourself family plan, come again, I'm not understanding.
Like, it is not provided by
Separate
the
గా.
company. Separate గా మనకు మనం తీసుకుంటే.
So separately you can take that
Then also it will be applicable only for that
for
spouse and
your
for
family.
the.
Yeah. Yes.
Okay, ma'am.
Yes. Any questions?
No more questions.
Yes, come on. Any questions, guys? Do you have? Everyone. Sarika. Why it just went to 15 out of 17? Inka. Still, do you guys have any questions on this part? So tomorrow we will be covering like managed care and types of managed care plans. So health maintenance organization, mcare key. So we will cover these three topics. Okay, any questions you have
Okay.
till here, like what exactly we have covered? Yes or no, maybe? ఏమైనా క్వశ్చన్స్ ఉంటే అడగండి, సో లేదంటే లేదు అని చెప్పండి, ఇలా సైలెంట్ గా ఉండకండి. దాట్స్ ద మెయిన్ థింగ్ విచ్ ఐ request from you guys. Take it as a request.
Told that you will give the history of healthcare.
Come again, ma, today?
Not today, ma'am. You told that you will give us the detailed history about the US healthcare.
Acha, thank you for reminding me. Sorry, I forgot about it. Yes, sorry. Okay, so I'll definitely cover this. I mean, a brief history about. I mean, we'll delve deeper a bit more into U.S. healthcare history. Definitely, I'll do it. I'll make sure that I remember this and I'll cover on one day. Okay, na? Yeah, sure, I'll do this. No worries, Prasanna. I'll cover this. Okay, then, chalo. Then that's the end of the meet today. So we'll complete the rest. I mean, we will continue the rest today.
Okay,
Someone.
ma'am.
Yeah, tomorrow any one of you come up and then cover like give a brief summary about what we have covered today's class. నేనందుకు నేను అడగకుండా, సో వాట్ వీ హ్యావ్ కవర్డ్ అన్నప్పుడు మీరందుకు మీరు ముందుకు వచ్చి మాట్లాడండి, చెప్పండి. ఓకేనా? డు నాట్ మేక్ మీ లైక్ వెయిట్ ఫర్ మోర్ మచ్ టైమ్. అండర్స్టూడ్?
Yes, ma'am.
Sure, ma'am.
Okay. Thanks for the day, guys. Okay. Any questions you have, you can ask me right away. If not, yeah, we can just